Hello. Hi, Yogesh. Hello. Hello. Yeah. Huh? Oh, is it? Why is that? I have just watching some.
Go ahead, Smita.
Hello, everybody. Welcome. Good morning, good evening, and good day wherever you are. Welcome to all to our WHEELS webinar on global pandemic, local remedies, Ayurveda, yoga, and traditional healthcare. I am Smita Siddhanti, your host, and also the board member of WHEELS Global Foundation. Ashok Siddhanti and I are delighted to be a sponsor of this webinar. By the way of my introduction, I am the founder and president of a consulting firm, Andina Inc. here in Washington, D.C., working to bring health, safety, and environmental solutions to the government of US. My own passion and involvement with entrepreneurship is not only as a global board of trustee of THI, which is the Indus Entrepreneurs, which is a global organization encouraging entrepreneurship, but my engagement for the past 3 decades is in rural entrepreneurship in India with an NGO in Maharashtra. The NGO is called Magan Sangrahalaya Samiti in Wardha. The pursuit of MSS aligns with the WHEELS Foundation, and that's how I'm very aligned with the rural entrepreneurship work here at WHEELS. MSS is committed to creating a sustainable rural employment following the Gandhian principles of economy of permanence. The idea is to assist the rural artisans, farmers, and women with technology innovations and scientific developments to create sustainable enterprises by converting techniques to trades and processes to professions. This requires building on the traditional and indigenous knowledge, supplemented by the technology and scientific advances, which is also the focus of today's webinar. We are looking forward to hearing from our esteemed speakers about the age-old wisdom and scientific knowledge of AYUSH and how it's being advanced to become mainstream and supplement the dominant allopathy healthcare. Now a bit of introduction about WHEELS and how you can get involved. WHEELS was started in 2006 and incorporated in 2013 by alumni of Indian Institute of Technology, IITs. Our mission is to offer a technology solution to scale efforts for the problems of water, healthcare, energy, education, rural livelihood, and sustainability. Where solutions do not exist, we encourage research and development at the IITs and other similar institutions through partnerships and sponsorships. We work collaboratively with partners like IEEE, Mission Samriddhi, SEVAK, Spoken Tutorials, and others. We are a volunteer organization and depend on the generosity of our many donors and patrons who believe that scale can only be achieved by leveraging technology. After implementing many projects for clean water, healthcare, sanitation, and education, etc., we have embarked on an integrated approach for smart village development. Our first such initiative is in Aravali district in Gujarat, where we are working on many projects that were jointly prioritized by students from IIT, the local panchayats, and is being implemented by partners like IEEE and Mission Samriddhi. We welcome you all to get engaged with us. Our tagline tells it all: technology-enabled philanthropy. That's what says it all. I hope you saw the video that was running prior to this event, and it will be running again after the webinar is over. So there will be links to the WHEELS website. Our website is www.wheelsglobal.org and www.wheelscharitable.org, where there is also a donate button. So please feel free to explore and get engaged. A quick disclaimer about this seminar today. All views here are expressed by the speakers in this webinar, and it's their own views and do not reflect nor are they endorsed by WHEELS Global and charitable foundations or its board and its members. I have some housekeeping messages. All attendees are on mute throughout the seminar. If you wish to ask a question to the speakers, you may do so by entering the question in the Q&A. If you need any help or instructions, you can chat with one of us by raising your hand or typing your request in the chat box. If your question remains unanswered, we will attempt to send you an email at the end of the event, or you may also send us the question by email to info@wheelsglobal.org. A recording of this event will also be available on our website. And now, it's my distinct honor and privilege to introduce the chair of this webinar, Ambassador Pradeep Kapoor. Acknowledged as a luminary diplomat, he is the managing director of the Integrated Smart Village Development Program of Wheels. He has had a distinguished career working closely with leaders and policymakers in different continents of the world: Asia, Southeast Asia, Africa, Europe, North America, and South America. He brings with him years of on-the-ground experience in countries as diverse as Tanzania, Nepal, Cambodia, France, China, Chile, besides rising to the level of secretary at the Ministry of External Affairs. With that, I am handing over the mic to Pradeep ji. Thanks for, and I hope you all enjoy the program.
Thank you very much, Smita. I appreciate those comments and the introduction. We have with us a very large number of speakers from different continents, different time zones, senior policymakers, decision makers. So we welcome them all. We look forward to a very interesting and useful discussion today. There's a lot of excitement. There was a lot of buzz. So I have now the pleasure to introduce our panel. First, I would like to introduce our moderator, Yogesh Handley, co-alumnus of mine from IIT Delhi. He is the co-founder of some of the pioneering institutes like School of Inspired Leadership, and also the co-founder of the Nuclear Software, which is one of the pioneers in the banking space in the world for software. He has been a mentor and an early stage investor. He is co-chair of the FICCI Startup Committee. He's advisor to the Millennium Alliance Program, board member for IIM Udaipur Incubation Center and KIIT Business Incubation Center, and director of the Wheels Charitable Foundation. The distinguished panel of speakers includes Professor KARTAR Singh DHIMAN, who's the Director General for Central Council for Research in Ayurvedic Sciences. The right person to speak on this topic today. He's a very highly accomplished academician, practitioner himself, researcher, administrator, with a very distinguished career spanning over 25 years in reputed organizations in Ayurveda in the country. He holds a PhD in Ayurveda from SSU Banaras and MD in Ayurveda, SOUKYA from Gujarat Ayurveda University. He is also the author of many books, many research articles, technical reports, course materials, and monographs, and has been keynote speaker at many conferences globally. Our next speaker is also the first speaker in this conference will be Dr. Isaac MATHAI. MATHAI is the founder chairman. He is the managing and medical director of SOUKYA International Holistic Healthcare Center at Bangalore. He is visiting consultant in several holistic health centers in Europe and USA. And this international experience he brings to this discussion. And SOUKYA, being the first of its kind holistic health center in the world, treats guests and patients from Hollywood, from elite in different countries. And along with SAHAYA, SOUKYA is the first accredited AYUSH hospital, focus on early intervention and medical treatment through integrative medicine. He also runs many charitable clinics through SOUKYA Foundation, which benefit a large number of poor people. We will be talking about AYUSH today, Ayurveda, Yoga, Unani, Siddha, Homeopathy. And many of us already are quite well aware of various aspects of AYUSH and Ayurveda. I will just go over some of these aspects very briefly to put us all in the mental frame for the discussion today. You have the 5 koshas in Ayurveda, the Annamaya kosha, as you can see on the screen, which is at the physical level, the Pranamaya kosha, the energy level, the Manomaya kosha at the mental level, the Vigyanmaya kosha at the intellect level, the Anandmaya kosha at the spiritual bliss level, and then you have the Jivatman, the Paramatman. What I will be requesting both the speakers to address, first Dr. MATHAI and then Dr. DHIMAN, are to take up the following points and sort of enlighten us in the areas of, for example, education. What are the pros and cons for AYUSH? What sort of access availability is there to the knowledge base? What are the language barriers, in the sense if a lot of the data and literature is in Sanskrit, how does one overcome that? The trainers, how are they trained? The international collaboration aspects, the research aspects. At the policy level, I would request them to touch upon the preventative aspects of policy, the curative aspects, the maintenance aspects, the innovation and intellectual property, and facilitation for wider acceptance. And how do we create reference-based knowledge, which could be similar to what we have in, for example, other countries. In the USA, there is the National Institute of Health, which has the PubMed and Medline. There is a traditional knowledge digital library in India. The practitioner level, we discuss, for example, training and certifications, access to the reference-based knowledge, what are the best practices, the infrastructure and application of technology. What I'd like to request Dr. MATHAI to speak on and focus upon in these areas, also with reference to the private sector, the role of the corporate sector in AYUSH, the public-private partnerships, and how it is increasing its footprint globally. And just one last comment before I request Dr. MATHAI to take over, is that just as a layman, if I am to see the geographical density and mapping of Ayurveda hospitals and clinics, or AYUSH hospitals and clinics, whether they are Ayurveda or Unani or Siddha or homeopathy, hospitals and clinics, not practitioners alone, but and just have a rough comparison with allopathy in any city of India, any part of India, you see that the density is much larger in allopathy. So we can address that also, whether we can think of a future where we can do even better than what allopathy does in terms of even the accessibility, availability to the common man. So I now request Dr. Isaac MATHAI to start his presentation for 10 minutes. After that, we will conclude that and get on to the next speaker. Thank you, Dr. MATHAI.
Thank you, Ambassador Pradeep Kapoor, for inviting me for this webinar. And this is my passionate subject, and I am practicing for the last 35 years, established SOUKYA in India, Bangalore. Being a proud Indian, and practicing yoga and Ayurveda as my personal health purpose for the last 35 years, and yoga for my personal purpose, as well as teaching yoga around the world in my early years. And now my center in Bangalore, because I want to show to the world what India can do in a clean, neat, good environment in an organic farm. We can provide Ayurveda, homeopathy, naturopathy, yoga, and in a healthy food in organic farm and all that. So that I expected when I established that I could get about nationalities to come, but in the last 20 years time, we had more than 100 nationalities, actually 110 nationalities, a lot from America, a lot from Europe and around the world coming over, not because of SOUKYA, it's because of India's ancient knowledge and wealth of knowledge and what it can provide. As a practitioner and treat patients from around the world, I can with the full confidence say that India's biggest contribution to the global health is the AYUSH and different systems of medicine India can provide. And in the beginning, with the Wheels Foundation's initiative, and I mentioned, Madam Smitha was mentioning about the role of, in water and several activities you're doing. Healthcare is one of the major activities Wheels Foundation is doing. My recommendation is your healthcare cannot be disease-oriented healthcare with allopathic Western medicine, but it should be the healthcare of different systems of medicine, especially the Indian systems of medicine, where integration of different systems along with the Western medicine, other systems of medicine which I'm practicing and I'm promoting, and that aspect should bring it in. And our village model, where we are treating 40,000 people with our village clinic, which is along with the Western medicine, which is given by the government of India, we are providing Ayurveda, homeopathy, naturopathy free of charge. And the international agencies have studied and find out that this model is very good as a health-oriented model, from schools to villages to hygiene to medicine to preventive medicine, all these things. Anyway, going to the subject, India is blessed with the different systems of medicine, and our governments all along. Modi ji is very supportive to the AYUSH systems of medicine, and after establishing AYUSH as a ministry, we are going forward with the promotion of that in big way, which yoga got global acceptance, and I think now is the time for other systems of medicine. Even some of the systems like Unani came from Greece, came through Persia, came to India, now is well established in India. But our mother system of medicine is Ayurveda, and along with that one, homeopathy, Siddha, Unani, Tibetan medicine, and therapeutic yoga, this is also part of it. So how the problem in India, what we are facing is the systems are very, very effective in treating a lot of chronic diseases and several benefits, but the systems are not integrated. So like allopathy is independent, Ayurveda is independent, homeopathy is independent. That's what I believe, that integration of different system medicine, of using the appropriate system of medicine, that's the answer for the future. While we are going through the COVID situations, today I was talking to Dr. Naresh Rahan in Delhi, that I was treating some of the patients admitted there with the COVID and with the homeopathic medicine and Ayurvedic immune boosting medicines. Why don't we work it together and make it as a model for the world, that the homeopathy and Ayurvedic medicine, which government of India is recommending, given in an allopathic hospital, and study that the impact of that several patients where I am treating around the world is recovering very fast, without complication. This is the future where India can give a lot. Looking at the benefits of AYUSH, I could say that these AYUSH systems are very effective for chronic diseases and degenerative diseases, arthritis, neurological disorders, all these things. And also the focus on this one is lot of focus of these medicines are on prevention and early intervention. I would say that no other systems in the world having that kind of a concept, especially in Ayurveda, looking at the dinacharya, that is the daily routine, and things you should do on a routine basis to improve your health and well-being. That means it will prevent your diseases. And the main other advantage is there is no side effects in any of the systems, which is the AYUSH systems, which is use thousands of local herbs and local medicines and local material, which is again is helping the rural population, and herbal medicinal plants manufacturing from the village people to the tribal people to all over. We are collecting medicines from such people. So that economic impact, for example, last week the government of India AYUSH Ministry said that after the COVID and the declaration of ashwagandha is one of the most effective medicine, there are demand for ashwagandha is growing like a manifold. But the issue is, what is the issue of this one? If you look at what is the negative side of it, there is a surgical conditions and other things. Western medicine is the best option. And there is not enough research in this Ayush system of medicine because of lack of funding. There is not enough awareness among the population about the clear use of Ayush in different conditions. So these are the areas where we have to change into Ayush into a lot of different ways. So the other aspect is, India with the Ayush Ministry, I was working with the Ayush Ministry in so many different projects and things like that in the last 15, 20 years. Government of India with Obama administration took a lot of initiative to have a collaborative research with the National Institute of Health in US, and their delegation came. I was a part of the Indian delegation, but nothing else happened beyond that. There is no meaning of we are doing thousands of research work in Indian institutions and try to show that that is the answer for this. In my opinion, we should collaborate with the best of the best international universities and National Institute of Health, some kind of institutions, to show the effect of the medicines and result of that in different people. So research, for example, simple research in coconut oil, which is a simple health beneficial product, which made the coconut oil usage all over the world in many fold. The same way ashwagandha, same way turmeric, research work on turmeric on intestinal cancer helped the turmeric used by people from Japan to America, everywhere in a big way. So this type of research findings will definitely improve. That is what area we are not doing very good. And India, I don't know why we are not that very good at the research area. So the conducting research with the collaboration with international organizations is very important. If you look at the number of colleges, India has more than 500,000 qualified Ayush doctors. Every year we are bringing out 50,000, more than 50,000 qualified Ayush doctors going through 5 to 6 years of medical program and coming out. We have for almost like 4,000 Ayush hospitals in India, 27,000 dispensaries in India, and drug manufacturers, about 9,000 drug manufacturers in India. But if the standards are good enough, in my opinion, it is not good enough. So we have to look at it, how we are going to improve that. And what we need to do is, because a lot of the Ayush system, especially Ayurveda is and yoga and naturopathy is focused a lot on preventive thing. And we have done some small work in Ayurvedic treatment on people, about 40 people. And we have seen that the result of that one is showing in a lab that, it is inflammatory markers are reducing, coagulation factors are changing. So it is a lot of this research. If you do in a big way, it can definitely help us to take it forward. And a lot of serious disease conditions which Western medicine cannot do anything, from the liver cirrhosis to arthritis to spondylitis to disc prolapse to fibromyalgia. We have several patients coming from US with the fibromyalgia, and as well as conditions like optical neuritis, where nothing can be done in Western medicine. Ayurvedic and Ayush systems are very, very good. And neurological disorder is one area. And the other aspect is the maintenance. And not only you improve your health, but maintain your health by a yearly panchakarma, yearly treatment, yearly detoxification. That will help a lot. But the issue we are facing at the moment is getting wider acceptance around the world. Fortunately, Ministry of Health as well as the Prime Minister tried to establish Ayush Center in London in collaboration with the Prince Charles. We started one Ayush Center. My recommendation is to create more Ayush centers in collaboration with the National Institute of Health and all universities around the world, so that we could showcase to the world that the systems on medicine can help and contribute a lot on healthcare, global healthcare. So finally, what I could say is the collaborative work with the medical institutions around the world, showing the wealth of knowledge from India and showing that what all we can do, and it will have a huge impact to help the healthcare of the not only people of India, the globally, as well as economically. It is going to give millions of people job opportunities, as well as our herbal products can be sold. Like China is doing a lot on their side. We should follow that. And leadership, people with the great leadership like the Wheels Foundation and people involved with this initiative should help with your network and everything, and help the government also to take it forward. Thank you so much.
Thank you very much, Dr. MATHAI. And it's amazing what you say. It's very interesting, very educative, very useful, very good discussion. I'm sure you have a lot of other points. But what I like most about your thing is all the issues you have raised, the questions you have raised, and that you're stuck to the time limit, 10 minutes. We appreciate that also. We will now move ahead. I want to announce that the event is also on Facebook Live. There are a lot of viewers on that also. Dr. DHIMAN, the Wheels Global Foundation, the W stands for water, H stands for healthcare. Now, we are doing a lot of work on healthcare in the villages in India and in USA also. And we'd also like to discuss as part of the discussion later, and Yogesh takes over as the moderator, is about whether wheels can also help in the efforts of AYUSH ministry or the efforts of the Central Council for Research in Ayurvedic Sciences in any way, because we have those interests in AYUSH also, promote AYUSH, increase the footprint of AYUSH. Now, Dr. MATHAI has raised questions and issues which are of direct relevance to the Ayurveda setup of the Government of India, AYUSH setup of the Government of India, and globally also, how we sort of increase the footprint globally. In the field of yoga, we have been very successful. The International Day of Yoga at the UN accepted by more than 170 countries. The moment India proposed it, immediately became an accepted act and is being implemented regularly year after year. So what about the other legs of AYUSH, the Ayurveda, the Unani, the Siddha, the homeopathy? How do we increase the international footprint? And I would also request you to, focus upon also the aspects of public policy in India, global perspectives, thought leadership aspects, and the public sector, the public-private partnership aspects. Besides the aspects which you mentioned earlier in the bullet points, I know it's a very tall order in 10 minutes, but the floor is yours for 10 minutes. Thank you, Dr. DHIMAN.
As per India's IST, good evening to all. Gitanjali ji, Pradeep Kapoor ji, Yogesh ji, and my dear friend Dr. ISSAC MATHAI ji. Very good evening. And Dr. MATHAI has made my issue very simple because he has given the overview of what is going on. But I will be little bit explaining about the different aspects of Ayurveda, including its education and up to its global aspects, as our chairman has desired today. Friends, in India, the AYUSH systems are very well regulated from the parliament of the country. And under this, there is a well-regulatory framework in the country in the field of education, in the field of research, in the field of standards, maintaining standards of the medicines, in the field of industry. Education is being regulated by a council, Central Council of Indian Medicine and Central Council of Homeopathy. Now, both the councils are going to be converted into commissions, and the act in the parliament is going to be passed in the next session, most probably, since last 1 year the process is going on. At present, more than 500 AYUSH education institutions are there, wherein more than 400 are of Ayurveda, and likewise homeopathy, likewise yoga as a Siddha, as well as of one of the system in AYUSH. I think every one of the listeners, the participants are aware about this acronym of this word AYUSH. This AYUSH is a word acronym which stands, A stands for Ayurveda, Y stands for yoga and naturopathy, then U stands for Unani, S stands for Siddha and Suaripa, and H stands for homeopathy. So these all traditional systems along with the German origin homeopathy system are grouped under one ministry which came into existence with the present Prime Minister's first term in 2014. And these colleges are controlled by different universities. They are all under university framework, and 4 separate universities, monofaculty universities are there in our country, which gives only Ayurveda education. And the oldest one is Gujarat Ayurveda University, from where I got postgraduate education, and I'm working at present and on deputation to the present post. Second is in Rajasthan at Jodhpur. Third one is in Haryana, Kurukshetra, and fourth one is in Dehradun in Uttarakhand. So these 4 universities are exclusively for Ayurveda education. In these colleges, more than 25,000 students are taking admission every year. And likewise, among these more than 500 Ayush colleges, 115 colleges are imparting postgraduate education also. And the intake, every year intake of postgraduate departments is more than 2,000 students. So every year, more than 2,000 postgraduate doctors from Ayush systems are coming out of these postgraduate institutions, and more than 25 Ayurveda institutions are imparting PhD level degree and research programs in their respective colleges. This way, the present number of practitioners of Ayush systems is more than 7 lakhs in the country, who are either doing the private practice or working in the government sector. And so far as the industry is concerned, as Dr. MATHAI told, more than 9,000 of the GMP certified, GMP means good manufacturing practices. This is a act of the parliament where every industry has to be good manufacturing practices, norms to be fulfilled, then and then it can stand. No pharmacy below that standard can exist in the country, and these pharmacies are manufacturing Ayurvedic products. And for making these Ayurvedic products, there is a pharmacopoeia commission which regulates the pharmacopoeial manufacturing standards of single ingredients of the medicines, as well as the formulations, compound formulations. And as far as I know, from Ayurveda Pharmacopoeia Committee, as being the member secretary, I am remembering on fingers that more than 600 single plant monographs are published in that pharmacopoeia, and more than 200 compound medicine standards are published in that pharmacopoeia. To have that standards of medicines, we need a genuine, authentic, and standard raw material. So ministry has made another arrangement, government has made another arrangement of having a National Medicinal Plant Board. That National Medicinal Plant Board is encouraging the farmers, the growers, and the herb traders to, and the industry also. It has become a mandatory, a corporate sector responsibility that whosoever is the industry, he has to grow the medicinal plants also, so that the need or their need in the future can be fulfilled. And likewise, government is also incentivizing the farmers to go for the herbal cultivation, propagation, and cluster regional clusters are being supported by the government, so that all these produce of the medicines are collected, and they can be, quality enhancement can be done, and they can be brought to the market. So the drug is also drug standards are also controlled by Drug Controller General of India. This is a single Drug Controller General of India in the country for both the systems, modern medicine system and Ayush systems, and a parallel structure has been created in the DCGI by the ministry, and that has just started working. As far as the research is concerned, this is well regulated. 5 research councils are there under the Ministry of Ayush. For different systems, different research council is there. For Ayurveda and Swaripa, there is a Central Council for Research in Ayurvedic Sciences. For Unani medicine, similar council is there. For homeopathy is there. for Siddha system is there, and for homeopathy is there. And all these research councils are headed by a quality selection process man from the country among the competitors as a director general of the research council. At present, I am heading the research council of Ayurveda in the capacity of director general. And all these research councils are engaged in the fundamental research, in the classical drug validation and the safety, clinical safety evaluation, in the resource material, what they are using in the standardization in the research, as well as in the literary research of their respective fields. So, and as far as the Ayurveda Research Council is concerned, this council having its headquarters in the New Delhi, have a 32 research centers across the country. And I may tell you, we are not only concerned with the human research related research, but one of the center in the country is also dedicated to the veterinary Ayurveda research activities also. So we are also there we have a lot of role to play, because earlier to the modern system of medicine, our livestock was also being treated by Ayurveda medicine. And this way, and in the standards also, one thing I want to tell you, there is a one national raw drug repository. Now, where these standard materials, genuine materials repository is there. So ministry is having one national raw drug repository, which is also being managed by Ayurveda system of medicine, and the all genuine materials with their standards of identification. If someone across the globe needs some standard material, they can purchase from there, and a standard material in very little quantity, 2 gram to 5 gram to 10 gram, that material by paying the cost can be made available. Yes, Pradeep ji, you want to tell me something?
Yes, in the sense your last comment or two, because then we move on to the next phase of the discussion. There will be a lot of time for further discussions with the moderator and with the other speaker when we start the panel discussion. So just a comment, please, we can move on to thereafter.
Should I conclude?
No, okay, thank you. So let us carry on then. Thank you very much, Dr. DHIMAN. That is extremely useful, very valuable comments. Again, you have answered some of the questions of Dr. MATHAI also, and I'm sure of the audience. I see that there is, a lot of questions. There are a large number of participants here and in Facebook, a lot of enthusiasm, and we look forward to a very robust discussion shortly. And at this stage, I'm going to request Gitanjali to put the first poll for the participants. This is on challenges of mainstreaming Ayurveda. So this is for all the participants who are there. All those who want to quickly respond, you have a few minutes or seconds up to a minute. I'm just going to read out very quickly. What are the challenges in mainstreaming Ayurveda? Is it lack of research or proof around efficacy, access to medicines, certification or licensing, or lack of knowledge? Please choose whichever you wish to do as an answer, and after you punch it in, you can submit. The second question, based upon what you know about AYUSH, where should the emphasis be? Should it be on public policy? Should it be on more funding for research? Should it be on raising awareness, or any other areas? So you have the next 5 seconds to put in your decision or choice. After that, we'll quickly look at the results. Thank you.
You be here, better to be here.
So, Gitanjali, can we have a look at the results? So the results are as follows. Challenges in mainstreaming Ayurveda. The majority says it's lack of research or proof around efficacy. so that the speakers and the moderator can further address these issues. Next is lack of knowledge. Third is certification or licensing. And fourth is access to medicines. This as per our participants in the discussion today, who number more than 125 live on this Zoom and lots more on Facebook. We are not doing the poll there. We're counting the poll from there. So that is the result for the first question. Based upon what you know about Ayush, where should the emphasis be? The emphasis should be on first is raising awareness. Second, they say more funding for research. And third is on public policy for raising awareness and knowing more about Ayush. The emphasis should be there. So thank you so much, participants. We appreciate that very much. And now invite Yogesh and Lay to take over as a moderator and engage in a discussion with the speakers, thereafter with the attendees and participants. Thank you very much. Over to you, Yogesh.
Thank you, Ambassador Kapoor. And we have seen these results from the audience poll. So I would like to start with Professor VAIDYA DHIMAN, because you also represent the policy making arm of the country. For you're a part of that policy making system or arm. The audience feels that the emphasis in Ayush should be on raising awareness, and second, more funding for research. So could you please help us understand the efforts that are being made to raise awareness about Ayush? Dr. DHIMAN, please.
Yeah, thank you, Yogesh ji. At the policy level, there are a lot of initiatives which has been taken by the government of India, like the awareness about yoga. International Day of Yoga has been accepted worldwide. This is the initiative of the government of India. Secondly, Ministry has created a Ayush awareness cell in each country's embassy. So all ambassadors across the world who are there, the torchbearer of Indian culture and Indian government, they have been asked to raise a small cell of Ayush awareness cell, and I think we have reached in many countries. And if the international community is there, they can request the Indian embassy that they also want to have the access to that cell also. Third point in the awareness is Ayush chairs in the interested institutions, universities across the globe. And by this time, more than 15 Ayush chairs has been agreed upon, and they are in the process of placement, and recent selections has already been taken place, and more interested people who can contribute also, and who have that who want to have that Ayush chair, they can apply to the ministry. There are certain terms and conditions where they have to bear some responsibility, and Ministry of Ayush pays the to and fro fare also twice in a year to the professor on the chair, and they also give the remuneration to him along with his spouse, and if small children are there, and that institution where this chair will be located, they have to provide a living space and office for their working, and that way the awareness programs are going on. Yogesh ji, I am aware about, and many of organizations who are working in the field of Ayush, Ministry of Ayush is funding them from time to time in organizing certain Ayush related activities across the globe. This is also one of the awareness IEC program which ministry is funding. I think these three activities are going on across the globe in creating the awareness. So far as the funding for the research and is concerned, gradually this is increasing. Since last 5-6 years, the fund grant of Ministry of Ayush has increased to doubled. It has become doubled, and the capacity of the ministry has become 100% to utilize whatever is given to the ministry. So that scenario is a very good scenario where the performance has increased, 100% utilization is there, as well as the fund has been increased too, but it is not sufficient.
Well,
I tell
thank
you,
you.
this is not sufficient. We
Yeah.
expect from the government of India and through your good self also, we expect that it should be 3% of the budget of the Ministry of Health. If it does not come to 3 to 5%, Ministry of Ayush cannot deliver what it is expected from ministry at national level as well as at global level. So this is my viewpoint.
Thank you. Thank you. We hope that the government and the finance ministries of the government, they loosen their purse and spend more on Ayush. Now, I would like to turn to Dr. MATHAI. And Dr. MATHAI, would you like to reflect on the first question that what our audience feels, that there is a lack of research or proof around efficacy and lack of knowledge are two significant challenges in mainstreaming Ayush. So what would your observations be on this, Dr. MATHAI?
I would say that India being one of the global countries, and we are trying to showcase to the world that we do everything in a global standard and all that, but unfortunately, both in the Western medicine and in Ayush, there is not at all any much research happening. At the same time, we are the best of the best pharmaceutical companies producing and selling medicine all over the world. So there is a big mismatch here. One is, even if Dr. DHIMAN is talking about the ministry is doing, what they're doing is so little. And I have little exposure around the world. And 27 years ago, I was in China to attend the World Health Organization Institute for Chinese Medicine, and students are coming from all over the world. Now I heard 2 years ago when I went there that 30 different countries, they established Chinese medical institution providing that. Still, we are still talking about maybe a little bit here, a little bit there. We should completely open up and provide Ayush centers. That's a one good initiative by the Prime Minister. Started in London now. Let us start in the US, let us start in Africa, let's start around the world and provide Ayush to the patients. Second is about the research. There is no money. Whatever the little research you're doing is so sad. There's no money. And whatever the budget is given for Ayush is so little. A great country like India with enough money, we won't give it. So we need to provide that, and I'm sure that Ambassador Pradeep Kapoor will definitely agree that with this exposure, it should be done by a foreign external affairs ministry as India's soft power strategy. And that way, when you expand this around the world, India can do a lot. But what is happening, I'm working with, as an outsider, working with the Ayush Ministry for the last 15, 20 years, there's nothing much is happening. It's very sad. So we need to change it. Maybe people like you with the global exposure and experience and everything should come to board and say that this is what we need to do it. Because the ministry and the practitioners and the people in India has a limited exposure. We don't know our potential. We are sleeping, in my opinion. So we need more money. We need more action.
Thank you, Dr. MATHAI. In this current crisis, the COVID crisis, what we hear that large number of both homeopathic and Ayurvedic and other medicines and kadas and other things have been distributed very, very widely. So, Dr. DHIMAN, could you please comment on what has been done by Ayush, or what's the contribution of Ayush in the current COVID crisis and management, prevention management, immunity building that's going on by the Ministry of Ayush?
Yeah, Yogesh, systematically, I am going to tell you. First of all, Ministry of Ayush gave a advisory. and that advisory was very well propagated by government, and it was accepted by the PMO. First of all, it was made under the direction of PMO, and ministry propagated it widely. Number two, what we did that in the containment areas, where population was at high risk, from Unani, from homeopathy and from Ayurveda side in containment areas, the immunity boosting medicine was distributed. And as my council in Delhi itself, we intervened in 50,000 population containment areas, and we are following them weekly. And 1 month follow-up is kept there, and that will be completed on 22nd of this month. So likewise, homeopathies, and we are recording what we have given and what are the benefits. Secondly, for immunity boosting, this was in the Delhi, but secondly, at least at 30 places in the country, in different states, where the AYUSH institutions are there, government institutions are there, they have been encouraged to identify a containment zone, and there also we are giving prophylactic and immunity boosting medication, and that study has also been initiated. So that way, the ministry is working on the immunity boosting. And secondly, in the COVID patients, the immunity boosting and in prophylactic, in the working man force, which our Prime Minister gave a name of COVID warriors, we are having a structured clinical trial for prevention of COVID in those COVID warriors who are working in the corona wards. So that way, the message has been given, and the trials and population studies are being done.
Thank you, Dr. DHIMAN. I would like to turn towards Dr. MATHAI. And Dr. MATHAI, you mentioned in your observations that you noticed that in Dr. Trehan in Medanta is using Ayurvedic and homeopathic medicines in treatment or management of COVID patients. So what's your thought? What do you see now changing in Indian systems? Because there was my feeling is that there was a lack of awareness or appreciation of different pathies by different practitioners. So how's that changing now? Or what kind of work is required to be done in that area so that we have a mutual appreciation of all the pathies? Dr. MATHAI, please.
Thank you. That's a great question. That, actually in India, fortunately, with the present Prime Minister especially, promoted Ayurveda as well as AYUSH systems for immune boosting first, and as well as now for positive cases. And the Department of AYUSH has done a wonderful work on identifying which are the medicines in Ayurveda, for example, AYUSH 64 and Haritaki and different things to boosting immune system. And also in homeopathy identified as arsenic Cal-30, which is used for millions of people now, and the state governments are given privately to free of charge to millions of people. I know that they are given in all over India. So, and Siddha medicine is also identified for one is about immune boosting. I don't want to call it prevention, immune boosting. That is widely accepted, and that gives AYUSH, Ayurveda, homeopathy, and Siddha huge popularity, and the yoga practices also, the breathing exercises also. Huge popularity for the AYUSH system, and Prime Minister twice mentioned about this in his address to the nation. That was a great support for AYUSH. That gave a huge awareness about the beneficial effect of AYUSH systems in COVID, especially. People are so afraid and upset about that there is no other solution. That's number one. Number two, government now allowed, like Dr. DHIMAN is talking about, providing this treatment for positive cases. That is also showing good results at the moment. But as you mentioned, that working with the Western Medical Hospital, because the primary responsibility of treating COVID cases as of last week was given only to the Western Medical Selected Hospital. As of this week, as of today, it is changed. Even the Trivandrum Homeopathic Medical College is open towards COVID patients, like that several locations in Bombay. Several places are AYUSH doctors are going and giving medicines. So like today, I talked to Dr. Trehan that we could treat patients in your hospital or government hospitals, other places with the Ayurvedic doctors and homeopathy doctors, that our purpose is not about Ayurveda or homeopathy. Purpose is how can you do our best for our patients? Where if Ayurveda, homeopathy, naturopathy can help and breathing exercise help, why don't we do along with ventilators and oxygen supply and vitamin C giving and all that? So that should be a model. And India, we can prove that scientifically. Rest of the world come behind Ayush. And I would say it is wrong to say it's an opportunity, but at the same time, I would say this is a need of the hour to do that integration and working together without irrespective of systems of medicine. Thank you.
Yogesh, if MATHAI allow me, then I can add something to it.
Please go ahead. Please add.
Thank you, MATHAI ji. I want to share the experience of Medanta Hospital, what you are talking about. The first clinical trial in the country in a modern hospital, if started in COVID patients, it was by the pursuance of Dr. Trehan only. And I appreciate his efforts and endeavor that in the dengue outbreak 5 years back, he also gave a call from front to Ministry of Ayush that if you can do something for dengue also. And that time we initiated a trial on dengue, and he did the pilot trial in dengue also. At that time also, my council was associated with that clinical trial with the Medanta Hospital. And this time also, my council is associated with that clinical trial where we are giving Guduchi and Pipli. And my research officer is still with them in their hospital, staying with them. So this is the personal perception, personal efforts of Dr. Trehan, because a Ayurvedic wing is working with his hospital, and he saw the outcomes. He does not want that his doctors will prescribe Ayurvedic medicine. No, he put the challenge to the Ayurvedic doctors working there, and if the Ayurvedic doctor give him a result, he appreciate that result is there. Now he wants that how it is working. What is there in the drug, how it is working, that is the next inquiry we can do. But he is very much convinced that it works.
Thank you. That's a very interesting observation. So, I would like to ask a follow-on question on that. That how does innovation happen in Ayush systems, in all the Ayurvedic, Unani, etc., all these systems, and how is it captured for general practitioners? Could you please elaborate a little bit more on that?
I want a little explanation on your question. What do you mean by innovation?
So, you see, we all talk about innovation in everything that's happening today. Innovation is the key today. Be it new medicines, be it efficacy.
You want to know that how this system developed, how this knowledge came to the people.
How is innovation taking place in Ayurveda?
So far as in today's perspective in the global pandemic, how this idea came that how Ayurveda and homeopathy and all systems will treat the COVID. Let us take example, for example. So our science is so rich in knowledge that it is written that you need not to name any disease. You need not to name any disease. You see the clinical picture and treat accordingly. This is the general fundamental guideline for Ayush systems of medicine, particularly Ayurveda. And this disease, COVID, emerged with a low fever or no fever or high fever. This is a febrile condition, just like a flu, or what we call in Ayurveda, pratishay. So this is a flu-like illness. We have to treat it on the line of the flu. If this is a low temperature is there, then the intervention will be very different. If high temperature is there, certain medicines has to be added along with, but the main fundamental line of treatment will remain the treatment of the flu. But we don't consider that our drug will kill the virus or not kill the virus. But if the patient has recovered, so in that sense, we have balanced the body, we have created the immunity of the body to counter that disease, or we have removed the pathology or whatever abnormality was there. So that is the basic difference in IU systems.
Thank you, Dr. Dhiman. May I turn towards Dr. MATHAI once again? And Dr. MATHAI, could you please help us understand once again the fundamental difference in the approach of allopathic systems and the Ayush systems, be it Ayurvedic or Unani or Siddha or homeopathy? What is the fundamental difference between the two?
Generally speaking, in any Ayush system, most of the Ayush system, the approach is very holistic. So they treat the person as a whole. Even if you treat a cold or some acute diseases, that's a different phenomenon. But if you look at any chronic diseases, you treat them as a whole. In Ayurveda, you look at the body constitutions, your Vata, Pitta, Prakriti, then look at your lifestyle, your eating pattern, all these things. So it is a very holistic way. The Western medicine is very diagnostic oriented. Just now, Dr. Dhiman was talking about, irrespective of the name of the disease, in Ayurveda or homeopathy, treat the patient. Yes, name of the disease is important to management level, but treatment or medicine is not decided on the name of the medicine, but name of the nature of the patient. So 5 different arthritis patients will have a 5 different methodology of treatment based on the body constitution. Same way in homeopathy, 5 different, same diabetic patient or a arthritis patient, but treated with the 5 different medicine or combinations based on the body constitution. That is a fundamental difference. Second is, investigations can be used by both Ayurvedic, homeopathic, or the Western medical doctors. But the treatment protocol as a standard protocol is given by the Western medicine as irrespective of the people. Whether it's a gastric ulcer person coming, 5 of them come, everybody take the same medicine, same methodology, same thing. And also they don't interlink, which I see in my practice all the time. Somebody with a headache to stomach ulcer to intestinal IBS to joint problem, everything is inflammatory. So I will not give 5 different medicines. I'll give one course of treatment to change the inflammatory change in the system, or that body constitution is changed, or the in Ayurvedic way, the Pitta is changed, you have to do treatment for that. So the fundamental approach towards a patient is very, very different from Western medicine and the Ayurvedic systems of medicine. But with all the differences, it is very easy to work together, because I get a lot of referrals from Western medical doctors, and then we treat together the patient. So it is possible to do integration. It's possible to take it forward with combining together the Western medical advancement and benefits to the traditional medicine and the ancient knowledge from the Ayurvedic systems.
So thank you, Dr. MATHAI. I mean,
Yogesh ji,
yes, please.
Yogesh ji, they treat disease, and IU systems treat patient. Okay, this is the basic difference.
This is the fundamental
treat the patient, they treat the disease.
So, this leads us to the next question, which many people ask often, that in our allopathic system, the treatment is, there's a lot of evidence that is visible that this molecule impacted this disease like this. Whereas when we look at the holistic system, how can you make a comparison between the two, and how can you do any kind of trials comparing the two systems? So could you please share very quickly, 1 minute on this?
This is for me. Yes.
Please go ahead.
Okay. Yogesh ji, this is a very fundamental question about the difference in the approach, which Dr. MATHAI was earlier talking. This is their evidence that what molecule is working. But as per our fundamental approach, we have also the evidence. But what is the reason why our issue is, our viewpoint is not accepted? Because they don't understand. Because they don't understand our science or our fundamental. That's why they say that you don't know how it is working. But as per our fundamental, we understand this drug which we are giving, this is Vathar. This will pacify Kapha. This will increase Pitta. So we diagnose on these 3 fundamentals, and we treat the disease on these fundamentals, because each intervention which we give, that is working on Vata, Pitta and Kapha. So we know. And what now they want, this is the difference. Due to this difference, now they want, no, we don't understand Vata, Pitta and Kapha. You tell in your drug which is the molecule. Then we go to the reductionist approach. we isolate the molecule, and when that molecule is isolated and tested on that disease, either it is toxic or it does not work, or in very few time it becomes non-effective or resistant. Why? Because whole system, the approach of that medicine has not been used. So this difference will always exist until unless and until these systems are taken as a whole by the Western world. This is the basic viewpoint where we differ.
Fine, thank you, Dr. Dhiman. Geetanjali, my co-moderator, she has a few questions to ask. So Geetanjali, can you please ask your questions?
Yes, thank you, Yogesh. And I think my question is pretty much in line with what Dr. Dhiman was talking just now, and also the innovation point that you brought. So according to Ayurveda, the Ayurveda works at a 5 koshas, as we know. So the ailment can come from any of the koshas. So it's not just always the physical level that the modern science looks at. And also, as far as the Ayurveda is concerned, it works at a sukshma level, or the Gandha Tanmatra or the Gandha Tanmatra level, which the modern science has no ability to understand or gauge how Ayurveda works. So in that situation, by giving the kind of reins in the hands of the modern science to give the approval for these methods, I think that's where we're going to curtail a lot of this knowledge. And that being said, I would like to know that now that there's so many amazing practitioners that are working, who may not have degrees, but they have got amazing innovations they have done, or not innovations. So for example, my advisor who is right now listening, he has medicine that work on chakras, and that you don't need to take anything inside. So I think there are such amazing things that exist in Ayurveda. How do we bring that out and try to I need to know, like, how can you give the reins in the hands of the modern science to give the approval? So I would like to know both of you, because I think we don't need an approval, in my opinion, but yeah, I would like to know from both of you.
I think ISSAC MATHAI is the right person to answer this question. This is more not related to Ayurveda, related to yoga particularly. Please, Dr. Saab.
I would say that no, it is when you mentioned earlier about different layers in Ayurvedic understanding or yogic understanding about human being, and I have my personal experience with patients. I could see that it is not only most of the chronic diseases with the physical level issues. There are mental level issues. There is a spirit level issues, subconscious issues. Different layers of issues are there. In a Western medicine, maybe maximum we'll go to a psychologist or somebody like that. And all that issues are interlinked. Because 30 years ago, some abuse happened in your system, or somebody cheated you, something happened to your business. I've seen enough and more cases. So what I would say is any chronic diseases without some deeper impact, which is not visible by any scan or any present day modern medical investigative technique, there are layers of impact. I'm sure that in Ayurvedic treatment, which we do here, have huge impact in clearing that out in different layers. Yoga has a huge impact in clearing it out. But how do we scientifically prove this? That may need, as you said, that Western medical molecule-oriented approach of research won't work on this. So we have to take it in a different note. We, or the scientific community globally, should look at it in a different format and see the impact. For example, in yogic effect on your neurochemicals are studied in Harvard and other places. So such universities come forward and do research. I'm sure that you'll be able to see that changes in a research basis, that how is happening. That is, I'm talking about multi-layer of effect. But even if you look at the physical level, an arthritis or an optical neuritis, there are 100 cases are there in Ayurvedic treatment is effective. That study and the assessment of the impact is good enough as a research. Why should we worry that how is that combination of Triphala with this and that, Dhanvantaram worked in that person? That doesn't matter, because you are not, you can definitely study that because of there is no toxicity. All that is important. But if it is a natural and without toxicity and everything, what combination work on each person? That's a secondary study. Primary study, is it working with the patient? Where you spend $1 million in Mayo Clinic for optical neuritis, and they come for an Ayurveda treatment with us, and 3 weeks time they are getting improved, and 6 months time they are fine. What more evidence you need? Is there a visible evidence? So let us also take away our approach from Western mindset of approach to little bit of Eastern mindset approach where the mathematics and all the science of the world is all started. Let us don't underestimate our ancient knowledge and don't submit ourselves to the Western scrutiny and say that's only scrutiny. No, we have much better scrutiny systems and India is courageous enough to talk about it now.
Thank you, Dr. MATHAI. Before Gitanjali come into play, I shall like to put my Ayurvedic viewpoint. Hails to you very nicely, very nicely. How it is working, that should be a secondary issue. Whether it is working, it should be the first issue. Dr. Gitanjali, I am putting now the Ayurvedic viewpoint. What Ayurveda considers about life. What is life? The definition is given that life is a combination of 4 things. One is body, other is senses, third is mind, and fourth is spirit. And the contract of these 4 things for a particular period is the lifespan. And if this contract of any one of them leaves its contract, breaks its contract, there is no life. Now, if you are to address the senses, you are to address the mind, you are to address the spirit. Unless you address these 3 things along with body, you are not giving complete health. So there is the role of yoga along with the addressing the physical problems of the mind, body. And these all problems are interlinked because senses are the tools which are connecting the body with the mind, and that whole knowledge feedback is given to the spirit. Then the total knowledge comes into existence. That is internal knowledge about body to the whole system and external knowledge to the body. So this 4 things union has to be maintained, and a well coordinated union needs to be there, where the body has to be addressed properly, psych has to be, senses has to be, and spirit has to be. And that gives the complete definition of health that is there in the Ayurveda. Samdosha samagni samadhatu malkriya prasannatamendriya mana swasthiti avdhiyate. And now this definition has been accepted by everyone. And modern medical science is working on the spiritual health these days. How to have the parameters of spiritual health. So these things are not different. But as Dr. MATHAI told in his last version, I reiterate, whether it is working or not, it should be accepted first. How it is working, that can be a separate issue that can be resolved in the laboratories. But the human laboratory, first of all, let us do something for the benefit. So if this thing will be understood by the modern medical system, the scenario of the health system will change. Thank you very much.
Thank you. I think it's wonderful to hear both of you to this perspective and asserting ourselves in terms of the knowledge. It's really really enchanting, I would say. Majority of our attendees are going to be are actually from technological background. So I do want to bring a bit of a question, slight deviation from what we're discussing in terms of the technology. Now, there are 4 lakh herbs. We could use the technology, the artificial intelligence or the robots to detect what the herbs are, because the knowledge is getting lost. We can integrate Ayurveda with telemedicine and start giving that access to the rural sector or the whole world, actually. I think there are many things that we could do in terms of how technology can be integrated. I would like to know, where do you see the need of technology where we could actually start assisting the promotion of Ayurveda and Ayush systems across the globe using technology? And anything that you, any suggestions, anywhere you need help. So I would like to, again, both of you can answer if you can.
Dr. MATHAI can go first.
I would say that because we have thousands of herbs used in Ayurvedic medicine, one area what I felt is, or what I, not only my feelings, that a lot of Ayurveda doctors also talk to us, and there's an issue, is the qualitative analysis of the ingredient in each one. For example, if you take ashwagandha from Kerala to ashwagandha from Himalayas to other parts of India, how is the qualitative analysis? And there, okay, season to season, I can understand there can be differences, but that can be standardized. That is scientifically, if we can do that with whatever the technology can use, and not only about one, and several of the Ayurvedic herbal preparation, not only in Ayurveda and Siddha and Unani and all these systems of medicine, that will technology can do a lot. Second is, with the modern medical advancement and the blood and analysis, and even we have seen that 21 days of Panchakarma can remove toxins from the DNA. That's a technology. So we can use that for different type of conditions. Whatever the reason we did the treatment, but the DNA is cleared with the toxicity, that is amazing that no systems of medicine or treatment or anything cannot do this. So these are the amazing things. This can be monitored, but that required a lot of money and a lot of investigations as well as research rule. That's what our original question in the beginning, you people put it forward, and people are all saying, where is the money for all the research? If you put enough money and enough thing, very easy to, with not a lot of money, with a reasonable amount, it's easy to come out with all these things. So technology can transform actually the medicine, and also better growth of the medicine, better growth of the plants. So many things technology can bring it in. That's my view.
Great. Dr. DHIMAN?
Thank you, Gitanjali. Can you please run the second poll? We would like to have audience observations and then maybe follow up with a discussion on that.
Sure, sure.
Yes, so here's a second poll for our participants. We would like to hear your views and then take that up for discussion with our esteemed speakers. So first question is, India has depended upon Ayurvedic healthcare that's time tested. So where should we focus it? Should focus on Ayush healthcare or should focus on allopathic synthetic medicine? Where should government of India focus? And similarly, the modern medicine relies on synthesized versions of herbs and plant extracts. Most of the medicines have an origin in a plant somewhere or other, which is subsequently synthesized. So what would you like to prefer, whether derived products or the herbs at original source? So thank you. So wow, I mean, the overwhelming majority of our viewers feel that Government of India should focus a lot more on Ayush and Ayush healthcare systems. And they would love to use the holistic product, herbs, and not just the derived sort of this thing. Now, we will come back, we will discuss this further. Now, here are a few curiosities that we have had, and we also see that being discussed or asked in by our participants. You see, in the Western world or in the allopathic system, there is a very strong system of, the standardization and liability insurance and certification, etc. So how well is that? Is that an established practice in Ayurvedic systems of liability insurance and things of that kind? And for associated with this question is, do insurance companies provide for Ayurvedic treatment in their insurance cover, or Ayush treatments in their insurance cover? So, Dr. DHIMAN, would you like to respond to this?
Have given us. One is on the standardization and second is insurance coverage. Am I right?
Yes, one is liability.
And
Liability
of insurance.
and
Facility of insurance. Okay.
Yes.
So far as the first question is concerned, there is now a provision of quality assurance. Standards are there. That's why I told in my outset in my remarks that there is a provision of Pharmacopoeia Commission and the standards of compound formulations as well as standards of single herbal ingredients and mineral ingredients are there. So there is no question. And if these standards are not there, and whosoever is making out of those pharmacopoeial materials, they can have their in-house standards also, and they can submit, and we approve them till the government has not verified or created the standards also. Secondly, the insurance coverage. Why it is difficult for insurance companies to come into play for reimbursing the insurance coverage is that the treatment of each individual varies individually. So they want there should be a set protocol of treatment for every patient. So even in one procedure of Panchkaram, it cannot be similar. In the treatment of one single disease of common cold, it cannot be same for me and for Dr. MATHAI and Dr. Kapoor and Shri Kapoorji. So that can vary, and they reimburse the diagnosis. They do not reimburse what is given to that patient. They have a set, I can say, package. For this diagnosis, this much will be given. So that fixing of that protocol and fixing of that amount is little bit different. But now Ministry of Ayush has given certain guidelines that certain packages can be made fixed for disease condition, and a median of that package can be recommended for insurance coverage. So that way, in certain areas, the insurance coverage has started, and many of the private players has come into play for insurance coverage. But these issues are there, and they need to be addressed with a common consensus, because tomorrow, if some patient has spent 1 lakh of rupee on his disease condition, simple disease condition, which was diagnosed as a very simple disease, but the insurance coverage is only 10,000 rupees, then this will be a conflict, and this conflict can become a legal, and where ministry will be dragged and insurance company will be dragged, and this will make a loss of time and money to all the parties. So that is going on slowly, but these issues are there.
So thank you.
I think Dr. I must give his viewpoint, because he is in a private sector, and what are the issues related to this insurance coverage. Dr. MATHAI's viewpoint you must take.
So Dr. MATHAI.
Yeah, thank you.
Yeah.
The insurance coverage is now widely accepted by all the private insurance companies. Several of our patients, up to 2.5 lakhs rupees of insurance coverage is paid by the companies. They are looking at the genuine institutions and genuine treatment they are giving. They are very quite flexible, and then people are also now going for it. That way, India, it's a good thing. Second point you mentioned about the liability insurance. In general, in India, it is not a major issue because of majority of treatment. I would say that all the treatments, there is no harmful effect in anybody to have a complications or anything like that. So generally, I don't think many Ayurvedic or Ayush doctors are gone for a liability insurance at the moment. Maybe in the future it can change. And also, none of the Ayush people are doing any harmful thing or anything like that. And especially possibility of surgery is something that in the Western medicine can cause into liability and all that. So that is not coming much. Maybe in the future that may come up.
So thank you, Dr. MATHAI. Now, you see, there is a lot of interest from the global community to come and use our Indian systems, Ayush, and you get so many people coming to you from all over the world. So what is it that they are looking for, and how can we meet the expectations of standardization, certification, the way it happens in the Western world? So do you think that's a very important consideration for them? And if yes, how that can be, the standardization and certification can be achieved here?
So one is already in India, M.R.C.H, which is National Board of Accreditation for Healthcare, with all the hospitals of India, best of the hospitals and medical colleges, everything. They are the same people are doing for Ayush. So we are one of the first Ayush hospital for with an ABH accreditation in India with all the ISSAC systems. So our experience is very good that because standards are very high. So when internationally or nationally, when people know that it's an ABH accredited institution, you have a different quality standard and performance, and your control systems are very, very different from an ordinary clinic or individual doctor doing something or the other. That is more and more Ayush hospitals are going forward for that. Second is international patients is mainly at the moment coming for a chronic disease condition where nothing else can be done in the rest of the world. There's a recurrent meningitis from London to Parkinsonism to this and that and so many things. They tried everything else. So they are searching for, without we are giving enough publicity for it. In my opinion, even you take US alone, there are 25 million arthritis patients. If they know that Ayurvedic treatment, if you come for 3 weeks or as senior citizen, several health issues from Florida and other places, come fly to India, your health can be improved. I have hundreds of examples like that. How many millions are going to come to India? We won't be able to handle it. So we should show the good cases, not exaggerate. Don't tell lies. Don't tell, because you treated one case that you can treat everybody in the planet Earth. The proper information provided to the patients, they will come from the world. So that we should be able to do that. And in India, the biggest issue, even the yoga centers to other places, hygiene, even it's very sad. So we should maintain our high quality, especially as a healthcare facilities, even if it's a very simple place or not. To maintain a hygienic, clean place is not going to cost much money. It is not talking about Italian marble or anything like that, but a clean, neat place and surrounding. So that if you guarantee, then people from anywhere, any parts of the world will come to India. So India has that opportunity, but we have to make use of it.
So thank you, Dr. MATHAI. Dr. DHIMAN, one question that's often come up during our discussion is that a lot of Ayurvedic and Indian system practitioners have been trained in their families or in their small groups, and not necessarily may have gone to a Ayurvedic college or a Unani college or a Siddha college. So what is the mechanism to recognize them and certify them? Dr. DHIMAN.
Truly speaking, there is no mechanism. There is no mechanism. And since a registered medical practitioner can do the legal medical practice, now from 70s onward, there is no provision of registering such practitioners in the country. From 71 onwards, when this institutionalization of education happened through Central Council of Indian Medicine, so there is no mechanism. But there are, we know that there are many such practitioners who are familiarly trained and giving their services to the masses in the rural areas. But there is no mechanism. There are a lot of attempts has been made by NGOs and very many other organizations. But as per the parliamentary law, there is no such provision.
Thank you, Dr. DHIMAN. We are now we have consumed our 90 minutes of our session today. And this has been a very, very insightful session. And that's what I can see as comments on our chat box, that everybody's found it very, very interesting and very informative. We have not been able to answer a lot of questions that were put up by us. We assure that we will come back to you. We'll respond either through email or maybe have a chat, recorded chat, which we'll share with you. Now, before we close, Dr. DHIMAN and Dr. MATHAI, would you like to make your last observation in quick 2 minutes? So, Dr. MATHAI, your observations, the closing remarks, or what would you like to conclude our day as?
Thank you, Mr. Yogesh. Thank you, Ambassador Pradeep Kapoor, and thank you, Gitanjali, and the sponsor, Madam Smitha. And it's a wonderful session, and I'm very happy to hear that no interest from the panelists, other members, as well as everybody. But my view is the future of medicine. I'm practicing around the world and seeing patients around the world and see the advancement of Western medicine and also the possibilities and opportunities of the higher systems of medicine. India has a tremendous opportunity for us to have the integration of different systems of medicine, provide that for the people of India first, and also along with that one as an economic tool for helping people around the world, not just making money, helping people around the world, provide that integrated medical model with the Western medical as well as traditional medicine together to provide and ISSAC centers around the world. India government has to come forward, and India government should provide more funding for a genuine good research in this area. That way we could show it to the world as well as acceptability will come forward and like that. So we have to have a global promotion as well as local dissemination of the systems in a mass way. That will create India's healthcare in a different league. That is my opinion. Thank you.
Thank you. Thank you, Dr. MATHAI. Dr. DHIMAN.
Yes. Thank you, Yogesh ji. Thank you, Pradeep Kapoor ji, Gitanjali ji, and other panelists today. And very happy to share the platform with Dr. MATHAI also. Friends, the goal of healthcare providers is one, the happiness of the patient. To relieve the distress of the patient is the only goal. How we achieve it, that may be different. And I only expect that whatever has been discussed today, I only expect that this idea of how and why drug is working should be left for the second phase inquiry. First of all, let us be assured that the system works, and it should be brought earliest possible for the universal healthcare through this AYUSH systems of medicine. And this knowledge, this acceptance should be earliest possible with the healthcare providers of today's mainstream healthcare providers. And I think the earliest they understand this thing, the earliest we can be the global leader. India can be the global leader in providing a good health. That's what I am to say.
So thank you very much. Thank you, Professor VAIDYA DHIMAN and Dr. Isaac MATHAI for your excellent and insightful remarks. Thanks also to Ambassador Pradeep Kapoor and Gitanjali for acting as moderators in this session today. The takeaways, Dr. Kavita Kapoor was constantly observing, recording various multiple takeaways which are before you on the screen. And if I start, reading them out or sharing them with you, probably I'll take another 20 minutes. So I'll let them be there for you. These takeaways from today's session are before you, and it's clear that AYUSH has a very, very important role to play to ensure accessible and affordable healthcare for everyone. It's a well-established healthcare system which looks at its target as a holistic person, as a whole. So we are not treating a medical report or a medical, we are treating a person. And that's what is the primary emphasis. So with this, we come to an end to today's webinar. May I request Suresh to come in and share with us a brief about the next webinar that we are going to have 2 weeks from now. Suresh, can you please come in? Okay.
Okay. Thank you very much to Dr. MATHAI and VAIDYA DHIMAN for this wonderful and excellent presentation. It has been most educational. I would just like to add that based on the overwhelming response that we have gotten, not only for this event, but in general for the thought-provoking series that we have had, we are going to have a more deeper dive into the practice of Ayurveda and AYUSH in a couple of weeks. So I would request our attendees to keep a lookout for the announcement on that. And meanwhile, next week, in 2 weeks on June 26th, we have a a phenomenal panel, starting with Dr. Jayanti Ravi, who's the Principal Secretary for Health and Rural Development in Gujarat. And she will be joined by two stalwarts from our own community, if you will, Rajat Gupta, who is the chairman of the Wheels Foundation, and Deshpande, Gururaj Deshpande, who started the Deshpande Foundation, and he has done phenomenal work for rural development, if you will, in India. And they are going to be talking about how each one of us can make a difference in this world. It is a fascinating subject which talks about how we can all contribute to what we are experiencing in terms of the opportunities and challenges of addressing rural issues. That is on June 26th. You will be receiving an email to this effect shortly. So thanks to one and every one of you. Thanks Pradeepji, thanks Yogesh and Gitanjali and the whole team that works on these things. So over to you, Yogeshji and Pradeep.
Thank you. Thank you. With this, we conclude our session today, and we thank all the participants for their presence and the number of questions that were asked and your wholehearted participation in the polls that happened. So once again, we are a volunteer organization and depend on the generosity of our many donors and patrons who believe that scale can only be achieved by leveraging technology and working collaboratively. We acknowledge the support provided by Smita and her organization and Diana and Ashok Siddhanti. I'm sorry, I missed the name. So our tagline, we acknowledge that there's the support. Our tagline, technology-enabled philanthropy, says it all. There are links to our website, and you can watch the recording of this event would be available there. And finally, once again, thank you and thank you very much. We've taken a lot of time. Thank you, Dr. DHIMAN. Thank you, Dr. MATHAI. And thank you, everybody, and my hosts and chair and everyone.
And we will have the slideshow again running for those who missed it in the beginning. We will run it again. Thank you, everybody. Thank you to the speakers and all the team.
Namaskar. Good night from India.
Good night. Namaste. Namaste. Good night.
Thank you.
Namaste. Namaste.
Thank you, everybody, for staying back. I'm ending the session now.